Hey, good morning. Good morning. Coffee Conversations is on Tuesday. You know what it is. I don't know why I was feeling like this. Taco Tuesday. Taco Tuesday. You know, that's how we do it. Southern California. We here. How y'all doing today? Everybody good? Everybody good? Taking care of yourself? COVID-19 environment. Check in with us, get some information, get some inspiration. That's what we do. Coffee Conversations with Greg J. We're streaming live, Facebook, Facebook Live, YouTube, and then on demand over at beachcityradio.com, beachcityradio.com. Thank you so much for your support. We're emerging, just trying to be a prominent voice for the culture. Yes, we're based here in Long Beach, California. What a great city. But we are global. We're reaching all over the world, all over the diaspora. You know how we do it. Academics, influencers all over the country, and indeed even live from the continent of Africa, because we are all about the culture. So in the news, right, they're talking, a year ago, we had never heard of this COVID-19 coronavirus. It started breaking the news, and us here in the hood, we were like, hey, ain't no black people getting the COVID. Remember that? That's what we were saying. It's like, ain't no black people getting it. But here we are, man. 500,000, they saying, have passed away from the COVID-19 pandemic in this country. And I don't know about you, but, in the last 12 months, I've lost quite a few people, some very close to me, some, not close, but, you knew them, acquaintances and all of that, enough to hit you in the gut when you hear about their passing. Some very suddenly, you see them one moment online posting, or you might have talked to them, this morning, and then tomorrow you get the news, but then there's other stories where people have, gotten the COVID virus and then recovered. I have a friend of mine, a former coworker that I keep up with, and he contracted the COVID virus early on, and it didn't look good, but he survived. But when I speak to him every now and again, because, I don't know about y'all, but I would encourage y'all to do this too. I just check in on people. I just go through my phone, my contact list, and holler at them to say, hey, man, look, let me just check on you. Okay. Everybody cool? I don't want any business. I don't want to talk, serious stuff. I just want to see how you're doing and send, love and light vibrations your way. And when I speak to him, I think that, sometimes he's still, hey, he's feeling the effects of it, and haven't gone through that. But just thank God that he's alive, So now here we are a year later. We've had all of this experience. And then here they come with the vaccine. And I know that we in the community are skeptical. I am. I just keep it real. I'm kind of like, But at the same time, as a broadcaster, as a voice of community, I really want to, I don't follow me. We got to get the information and make up our own minds. And they got the guy Dr. Fauci all on the TV all the time and everything, And I just feel like we just want to reach out to our folks. We got plenty of medical professionals in our community, excellence all over the country. So I am striving to bring forth, the great African American minds in medicine, the healers, the experts, the folks that are out here on these here front lines doing it, so they can share with us in a very real way. They can sip coffee, talk to us, talk to their people, and say, okay, look, this is what it is, or this isn't what it is, whatever the case is. And we can all make up our minds, So I'm really happy this morning. I've been seeing her. This is my new friend right here. I just met her just online on a whole other project. Y'all remember when we did the Martin Luther King live stream? And, I had to reach out to her and say, okay, I need you to have a message about the COVID. But I have followed her, and I always talk about how I'm kind of new to Long Beach, but not really. A few years now, a full presidential term. How about that? And I see the sister down there like, hey, I'm one of the professionals, the voice, the one that's leading the charge in this pandemic environment, and I'm just proud of her. And just, uh, we stood up for her. She didn't know us, but we stood up for her when they were trying to question her at the city council meeting. You know how it is. So I'm just happy this morning that she said, okay, look, gee, I'm coming through to sip some coffee and let's talk about the vaccinations. Vaccinations. Ladies and gentlemen, Dr. Anissa Davis, good morning.
Good morning. Good morning. Thank you for having me.
Yes,
How are
thank you
you?
for coming. Doing all right,
Good.
considering.
Yep.
Yes, yes, yes. Okay, so Dr. Davis, first of all, how are you doing? I know you've been out here taking care of all of us in this beautiful city of Long Beach, but hey, how are you doing? How's your family? Everybody cool?
Yep. We're all doing well. You know, just staying safe, not really going
Hmm.
a bunch of places.
Hmm.
And I'm just busy. But we're
Hmm.
all, together and doing a few more things together now than maybe we did before, watching
Hmm.
movies and, fire pits at night and things like that. So we're doing all
Hmm.
right.
All right, all right, all right. So here we go. So the vaccine is here and it's going on, and so I, on one hand, I'm hearing there's disparities on how the vaccine is being distributed across the city of Long Beach, and then when I take a step back and focus my lens on across the country, we're hearing the same type of story. But yet, I'm hearing that in Long Beach is supposed to be a model of how the vaccine is being distributed. Even the governor was here in
Mhm.
Long Beach to say, okay, hey, great job, great job. Why is Long Beach a model?
I think Long Beach is a model because we have been able to get the vaccine out efficiently and quickly, and at a large scale.
Mm-hmm.
And I think to many different sectors. So I think that really is helping to make us a model. However, you could still be a model and have room for improvement. And so around distribution to all of our communities is definitely where we are really working to improve access and improve folks getting shots in arms.
Mm-hmm, mm-hmm. So, I heard from the District 6, heavily minority community,
Hmm.
and they were sharing that, hey, you know what, our seniors and the folks, the people aren't getting it. They have to travel too far to get the
Hmm.
vaccine or whatever. From your side of things, is that a truth, or what are you doing to try to make sure that those people are served?
Right. I definitely think that, their experience is the truth. And
Mm-hmm.
so I think in the beginning, there was a very big, because we were in such a big surge when the vaccine first came out, which we're still in, but not to the same degree, that the emphasis was on quickness and kind of large scale. And when that's your emphasis, there's going to be barriers that people aren't able to overcome in order to take advantage of this large scale or fast moving vaccine distribution. So
Mm-hmm.
now we are really working hard to address those barriers. So we have been out in the community. We've done some, we call them points of dispensing or pods. They're basically like mass vaccination clinics.
Mm-hmm.
We've done some focused towards Spanish speaking only populations. And we were at a park recently that focused on the Cambodian population. We did, I believe, 300 to 400 vaccines. I think that was just yesterday.
Mm-hmm.
And so we've been in parks, we've been at middle school. So we are definitely getting out there into the community to help address barriers of, transportation, the digital divide. We've also had community organizations working on getting people signed up. So, like,
Mm-hmm.
if you don't have a computer, you could call, those types of things. And then, kind of the next phase, what we're gearing up for is having mobile teams who can go to homes. So, if you're homebound or you have transportation, you don't have people that can take you to the mass vaccination site that will actually come to your home, and then also to senior living homes and like senior apartments and things like that. So that'll be ramping up within the next week or so.
All right, Dr. Davis, you got all that going on. You're doing your job. But, you know, I don't know. There's a lot of people out there like me who are like, okay, I'm looking at the history.
Mm-hmm.
I don't want to take the shot. Today, this is
Mm-hmm.
how I'm feeling. I'm not trying to take the shot. So then,
Mm-hmm.
what would you say to me?
So, first I'd ask why. Like, what are your specific concerns
Hmm.
around the vaccine?
So here's the thing. Well, that's probably a whole nother show. um, you know, here's the thing. When they had the swine flu years ago, I was in the Marine Corps, right? And they, inoculated us like right away. It was an order. Had to go down there to sick bay, get
Mm-hmm.
the shot, and keep on pushing. Got to do your job, right? And I have to say that I'm glad I did that. To this day, so 40 years later, I rarely get sick. I just don't get sick. And I always say, I wonder if that shot they gave me, keeps me healthy. But when I
Right.
also look at, what is going on in this country, there's a lot happening, and I'm very keenly aware. I'm not necessarily a conspiracy theorist. However, I am aware, and they're pushing very hard for all of us to get vaccinated. And so I don't know what the government is doing is my
Mm.
concern. I just
Okay.
don't know. And they haven't said anything that makes me say, okay, cool, I'm gonna go
Mm.
ahead and do the shot. I see all my activist friends out there online. I'm getting the shot. I'm getting the shot. People who I love and respect. I'm getting the shot. Get yours. Get yours. I still am not convinced. And I happen to know that there's a lot of me all around our communities across the
Mm-hmm.
country. Um, so, what say you?
So, one thing that I would say is that I totally understand the hesitancy of everyone. And I want to say that it's not just Black folks and it's not just people of color who are feeling a little hesitant or just not, you know, wanting to be the first ones in line necessarily. It's more so among people of color, but it's definitely everybody, and that's including healthcare workers, you know all sorts of sectors of people, and I think that's totally understandable. This is a new vaccine. It was developed, you know, uh, quickly, and so I think that that's normal. So that would be the first thing that I would say. The reason that I think some of that happened, the reason that, so although the vaccine itself is new, so this mRNA type of technology, which is just a little clip of like instructions that tell your body to make this thing called a spike protein, which is a part of the virus, but is just one little part. It's just the recognition part. And so the vaccine itself is just the instructions to that little part
Mm,
with a coding. And so that's what gets injected, and it tells your body to make this harmless protein. And then
mm,
what that does is once your body makes the harmless protein, that those little instructions are degraded. So they're not part of your body. They don't get into the nucleus of your cells. They don't interact with your own DNA or genetic coding.
mm,
So once that's degraded and you make this protein, your body sees that protein and says, oh, you're infected with the coronavirus. I'm going to do my immune response to
mm,
protect you so
mm,
that if you ever do come across the actual real virus, you'll be protected.
mm.
So it is a new technology. However, it's a new virus. However, that technology has been studied for decades.
Okay.
It's been studied for other types of vaccines. So Ebola, other types of influenza like the swine flu you were talking about, cancer, they're using it to try to fight cancer. And so the technology has been studied in humans. It's been found to be safe. The main issue around why they haven't used mRNA vaccines until now was that mRNA itself is very fragile, and so it's very easily degraded, and that's why you
Mm.
have to use all these special like freezing temperatures and all
Freezers
those
and
kind of
stuff.
things that you've heard.
Hmm.
Yeah, so that would be the first thing I would say, that it is new. However, it's been studied for a long time. And then the other thing around the quickness of it, which I think, again, I think I understand that would give people pause. This was a full global event. So usually when we're developing something, there's like a company here and a company there, and they're taking their time and they have to raise money, and they have like 10 things maybe they're working on. But this really was a worldwide event. We're going to put a lot of money throughout companies throughout the world just so that you can focus on developing this. A lot of companies work together, like the Pfizer vaccine is BioNTech, which is in Germany, and then a company here in America. And so there was a lot of money and a lot of focus. And they also did a lot of research kind of all at the same time. So they did their studies like very quickly, but they still didn't skip any steps. It's just that they really focused on this because it was such an important issue and people were dying. The other thing I'd like to say, because I do feel that, and totally understand that Black folks have not really gotten a fair shake in our healthcare system. I think there's a lot of things that have been done to us historically. We've talked a lot about the Tuskegee Institute, which was a government-funded study that basically let people have syphilis when there was a treatment for it, but they didn't give it to Black people because they wanted to study what the effects of untreated syphilis were. So that was a horrible thing, that you withheld medicine, life-saving medicine from a group of people. There's also, Henrietta Lacks, where she had cervical cancer and they took her cells without her knowledge. No one in her family got compensated. And those cells are used today to, anytime you're growing a cell when you need to study something, it's usually a descendant of her cells. And so there's a lot of things that I think we can all point to. And then I think how we're treated right now, within the healthcare system. But I want to say for this vaccine was created by us and with us and for us. So an African-American woman, Kizzmekia Corbett, actually developed the Moderna, which is one of the mRNA vaccines, and we were a large part of the studies, 10 to 13% of the people who were studied to get these vaccines authorized were African Americans, and then a much larger part were people of color in general, which is something traditionally we have not seen. We haven't seen that Black people are a part of clinical trials to the extent of what our population is, which is about 13%. And it's
All right.
and I want to
All
say
right.
it's just for us, this we're the ones dying, like you said. And so that's why I think it's important that we take advantage of the vaccines.
All right. So you say for us, by us,
Hmm. And with us.
and
Yep.
with us. Okay. So, okay. Here's Sheena Burns. She's asking, have you personally analyzed the contents of the vaccine?
I've looked at the list, so I know that the I can't rattle it off the top of my head, but I know
Yeah.
that there's the mRNA and there's the polyethylene glycol. So it's just the little structure of the mRNA, and then there's a coating, and so the coating is what gets it into the cell, and so that has polyethylene glycol, which is something that you see in other, like when you need to have a colonoscopy or a laxative, it's in that. And then there's something else called polysorbate, which is an additive that's in foods. And then there's a few other things. So I have looked at it. I don't know if there was a specific question that she had. I think the other thing I just want to say, around the vaccine hesitancy and what's going on now. So they I think that one of the important things is the context of the situation that we're in. So it's one thing when somebody's asking you to take a vaccine or to do something you're a little hesitant about, and maybe there's 2 people that have been infected and 5 people have died. But I think really looking at the context of where we are now, we've had 500,000 people in America who've died from COVID-19. At least 66,000 of those people are African American. And, when you look at that, and we've had nobody who's died from the vaccine, and we've had millions of doses now that have been distributed throughout the United States. And so I think that that's also something that I keep in mind when I'm trying to make decisions. What is the risk of not doing the thing versus the benefit of doing the thing. Oh, I can't hear you right now.
There I am. So
Oh, there you
I
go.
heard I heard that I did hear that people died from that though. From they took the vaccine and then were gone. So there were some news reports.
There have been reports of people who have died within a time period after having the vaccine. I
Mm-hmm.
have not seen that it has been tied to the vaccine. So I have not heard that they felt like the vaccine was the thing that caused the person to pass away. Um,
Mm-hmm. I see. So just the timing was off.
Yeah, I mean, definitely. So the other thing with this vaccine being new is that there is a lot of monitoring and tracking that's going on around the vaccine. So the CDC, the Centers for Disease Control, is looking really closely. They have a program called V-Safe. So after you get the vaccine, they'll actually check in with you, every day for a while, and then every month. And I think they follow you for about a year. And so and they ask all those questions. And if
Mm-hmm.
depending on what you say, they'll actually call you. So they
Mm-hmm.
are looking very closely right now, so more closely than we have with other vaccines.
Mm-hmm.
And yeah, I haven't seen where they can say that it was because of the vaccine.
All right,
That
Dr.
people passed.
Gloria Willingham Torre is asking, so your immune system must be strong in order for the vaccine to work? That's the question. And then she's asking, would there be a difference in expected outcomes for persons with a compromised immune system?
Thank you for that question. So, yes, the vaccine, we would expect that the vaccine would work best in
Mm-hmm.
people who have a functioning immune system.
Mm-hmm.
Um, However, it is not dangerous for those who have a poorly functioning immune system. So, say, for instance, they have advanced HIV, or they're being treated for cancer, or they have a variety of other immunocompromising conditions. They're still eligible to get the vaccine. It's still safe in them. It just may not work quite as well. And right now, there is not data to say for sure how well, or how it compares to people who have a completely functioning immune system. There's just not enough data right now
Mm-hmm.
to determine what the differences are between the two groups as far as how they respond to the vaccine.
Yeah, it's just very interesting. Let me ask you this. So there's all these different companies, right? And they put it out there like we are supposed to know if Pfizer or Moderna, and I think I heard you mention a couple of other companies about to jump into the fray. You
Hmm.
know, how do I know which one? I'm gonna go to so I'm gonna go to the Long Beach Health Department and say, yeah, I'll take the double dose of Moderna.
So, that brings up an interesting question, because you may not have a choice. So, all of these vaccines are in short supply,
Mm,
and the federal government is distributing them to the state, who then
mm,
distributes them to the local, counties and cities and what have you. And we get what we get, and that's what we offer.
mm,
Um, so that's one thing. The other thing is that they have all gone through. So right now, there's only two vaccines who are authorized to use, and that's Moderna and Pfizer. And they've all gone through what's called an emergency use authorization, which is the FDA process in order to be able to use the vaccine in a public health emergency, which is what we're
mm.
in. And everything around COVID-19 right now is operating under an emergency use authorization. So all of our testing, all of the treatments when you're in the hospital, everything around COVID-19 has been expedited in order to save lives. So
But what's the
So,
difference though? Like,
uh-huh.
just to a normal guy like me, what's the difference? And I'm hearing Johnson and Johnson's coming with it. So
Right, right.
yeah.
Yeah. So there's not a huge difference between Moderna and Pfizer.
Mm,
Pfizer was studied for 16 years and older, so you can use it for 16, whereas Moderna, it's 18 years of age and older. They both are mRNA vaccines, so they're both the little instructions to make sort of the same thing, which is the spike protein. They both have kind of the same common, what we call reactogenicity or side effects. So um, they're very common and expected. So most people will get a really sore arm for a couple of days afterwards,
mm,
and then you may get, fatigue and headaches and nausea, um, those types of things, feeling kind of like fluish. So those are the same. Another common difference is that Moderna is every 28 days. So they're both two shots to be completely vaccinated. But for Pfizer, it's the first shot, and then 21 days later, you get the second shot. And for Moderna, it's the first shot, and then 28 days later.
mm, mm,
Pfizer is more frozen than Moderna. That's where you need that ultra low temperature freezers, like super, super duper frozen, where it's Moderna is just normal frozen. So they're very pretty similar, those two vaccines. The J&J, which is the Johnson and Johnson, that is the next one kind of in the pipeline to be authorized, is somewhat different. So kind of instead of being an mRNA, it's a DNA virus. So it's still instructions. It's still telling your cells to make kind of the same thing, which is that spike protein, but it's just using a different type of instruction method, if you will.
mm,
And the great thing about Johnson and Johnson is that it's only one shot, so which is, will be very helpful. And it doesn't need all those special freezing temperatures and all that kind of stuff. So it's going to be much easier for, kind of your average doctor to be able to carry it and use it.
mm,
Um,
mm,
so those are the things with Johnson and Johnson. Uh, so all of them are very effective in preventing very serious illness, hospitalizations, and deaths from COVID-19. Johnson and Johnson right now, like we haven't gotten all the data yet, but it looks like the Johnson and Johnson one, you may be more likely to get like a mild case of
mm.
COVID than you would with Moderna and Pfizer. But for all of them, though, it's keeping you out of the hospital, it's keeping you from dying, and that's kind of, our main goal um,
Mm.
in preventing the virus.
All right. So, here's a question again from Shanna. She said it was made for us by us. So the companies that created the vaccine are black owned. But let me just say this. I love that question. But here's the thing, Dr. Davis. I trust you. I don't really trust the pharmaceutical
Mm-mm.
companies and the powers and principalities that are out there,
Right,
making us take this stuff. I
right.
trust you, my sister. I got you. Okay.
Mhm,
Even trust the sister that invented it, that worked on it in
mhm,
the lab and everything like that. What are you saying? I guess I'm trying to ask you. So, what can you do? Can you say, like from your heart, what can you say? You
mhm,
probably might not even have the answer, but to us, to me, Shayna, and others who are like, you know what? I see my sister, got you, but I'm not with the system.
mhm, mhm.
I just don't. How do we assuage that mistrust?
I think you know, uh, you make very good points, and the person, I think it was Shayna, who talked about the pharmaceutical company, is making good points too. Are they black owned? No. They are publicly traded, so a lot of us that have, IRAs and what have you
Stocks.
probably do own a little itty bitty bit of it. Um, and we live in a capitalist society, and so yes, people want to make money.
Mm,
um, I would say that that to me, that's that.
mm,
I feel confident that all of the safety measures were taken. And I want our grandmothers and our moms and our husbands and our sons to be here. We've all suffered. Everybody, you know, my husband's second wife died from COVID. Those are relationships that are gone. I mean, they're just, that grief is, you can't ever replace that.
Mm-hmm.
And so, somebody's making money. Okay. That has to happen. But here's this thing that can really change our lives and get us back to be able to um, maintain those relationships. And so to me, that's what I look at. I look at it, this is what I want for my community.
Mm-hmm.
I feel that it's safe. When you look at the whole, again, context of it, all these people who have died. Um, I want that to stop. Like, I want that
Mm-hmm.
to not happen anymore.
Mm-hmm.
Um, and so I think I'm willing to kind of step out a little bit. I'm scared as well. Like, I'm not a first in line type for new treatments in general. Um, but, I want my husband to be around. He's in his 60s. I want to be around. I don't want to leave my kids orphans. And that's happened. I mean,
Mm-hmm. Mm-hmm.
so I'm willing to take the risk.
Whew, that's a lot to consider this morning, there,
Hmm.
Dr. Davis. I mean,
I
man,
know it is.
let me share a screen with us here for us here. Just kind of really look at the statistics that have happened. I found this earlier today. So this is the a chart. Is just Google COVID statistics Long Beach, right? So LA counties had 32,429 cases. And let me just go over here and scroll down a little bit. So, I mean, that's a lot of folks.
Hmm.
And how many in Long Beach, California? You've had quite a few.
We've had, let me find exactly. Let me look. It's been, I think we tipped 500. So let me
Mm-hmm.
see. Um,
I typed in Long Beach, but it only gave me the county. Let's see. And
okay.
so,
We've had, oh my goodness, we've had 808 deaths. It's amazing how you don't look at something for one day and just these
wow.
huge, or 2 or 3 days. So yes, we've had 50,855 confirmed cases, and we have 808 deaths. And the thing that's difficult with that, like, it's us, it's
Mm-hmm.
Black people, it's
Mm-hmm.
brown people. So it's not hitting. I'm trying to, where are we? Let's see, it's not hitting us evenly, unfortunately.
Mm-hmm.
Um,
Now,
and mhm,
here's the thing. All right. So, see right here where I have it. All right. Right
mhm,
after here we had this great uptick, right? They were talking about the
right.
surge and everything like that over the holiday season. And then President Biden and Vice President Kamala got elected. This is how I see it, okay? Then all of a sudden, it started going down drastically. How is that possible if we were having such a hard time with the surge, and then when the new administration comes in, the reports
Mhm,
are that it was dropping so bad?
mhm. So, I think there were a few things that happened.
Mm-hmm.
So when we were surging, I think it was kind of this perfect storm. So
Mm-hmm.
we were, as you can see here, like around October the 1st, we were kind of,
Yes.
we were low, but they were there. You could see there were still
Yeah. Yeah.
infections.
Yeah. Yeah. Right up
And
in
then you
here.
had, yeah, and then you
Mm-hmm.
had Halloween.
Mm-hmm.
And anytime you have a holiday, we've seen that things, like about a week later, things start to tick up.
Kick up. Yeah. Yeah.
People, have parties and gatherings. So you kind of had Halloween, and that kind of tipped things up.
Yeah.
And then you had Thanksgiving on November 26th,
Yeah.
and I think that was really an explosion.
You
So
can see
the
it
week
right there.
after
Bam.
Thanksgiving was just a bomb had gone off. So
Mm,
that really set things off. And then after that, you had Christmas and
yeah.
you had New Year's.
Yeah.
And so you just had it was awful. It was really awful. And I think what has happened now is I think after New Year's, I do feel like there was a community understanding or awareness or acknowledgement that we were in it. You know what I mean? Like things were not good, and I think people really uh, stopped gathering for a while. To be honest, we also the state did a regional stay-at-home order that was around for Long Beach and Los Angeles County. That was around the 10th of December. So that also probably is playing a part in things getting a little bit better because that's when we stopped outdoor dining and we lowered the capacity limits for stores and things like that. But then I think a lot of it was just, in February, I heard a lot of people didn't get together for the Super Bowl. I think fewer people traveled over the President's Day weekend. I think fewer people got together on Valentine's Day. And I think those are the things. And then I think the other thing is that it's estimated now that about 50% of people in Los Angeles County and including Long Beach have been infected with the virus. So now your susceptible population has gone down as well because there's this huge proportion of the population that's already been infected. So I think those are all the things. And then vaccines, although, we've given out probably, I think, 50,000 vaccines in Long Beach. I believe about 5% of at least our older population, well, 5% of all of our population in Long Beach has had at least one vaccine. I think around 50% of our senior population has had at least one vaccine. So that's playing a part too. So I think there's a whole bunch of things that are helping us really get this momentum of improvement and decreasing cases.
So, this graph we're looking at, this is for California in general, and you have
Hmm.
3.54 million cases with 49,531 deaths thus far. You're saying
Hmm.
50% of the people um, have COVID?
So that's the estimate for Los
That's
Angeles
one
County and
out
Long
of
Beach.
two. So every other
So
person.
Yeah. So we've had this huge amount of people that have had symptomatic infection, and we know that about 40% of people who are infected don't show any symptoms at all. So there's probably a lot of people that have been infected and they just don't know it because they were lucky enough not to have any symptoms. So, and when you look at Long Beach, so 50,000 people that we know have had a positive test, right? Our population is 460,000. So that's just 10% right off the bat that we absolutely know. And then we also know that there's 40% who don't have symptoms at all. You know that there's going to be a percentage of people who got sick and just didn't go get tested. So yeah, 50% of people we think have been infected. It was a horrible surge. It was horrible what we just went through these last couple of months.
So I'm just trying to process this right now because I just need to stay right here in my studio. But I need to go to the bank and stuff, man.
You got to wear your mask and physically distance and
And what
go
you're
when it's
talking
not
about, I need to
busy.
wear my mask now. My goodness.
I'm
Okay,
just,
so
yeah,
let's,
letting you
we
know.
like to always point our lens to across the globe, especially
Mhm,
in the continent of Africa, because that's where we are. We're always about building bridges of music, arts, and culture with Africa and African Americans. And, we've talked directly to a lot of our friends down in South Africa, in particular, over in
mhm,
Kenya, over in Senegal, and Nigeria. I mean, we just had Ghana. We read some headlines a couple of weeks ago where the nation of Tanzania is refusing the vaccine, but
mm,
but has a government mandated herbal program. So they say we're going to do it with the herbs because there's medicinal quality. So I began to ask a lot of the broadcasters and professionals that we have on this show, hey, what do you think about that? And they were like, you know
mhm.
what? Hey, there's some truth to that. There's always some healing in the earth. What do you think about that?
I have to say that I am not that familiar with treatments for COVID-19, with herbal or alternative treatments for COVID-19. However, many of the things that we use in, established medicine are from the earth.
Hmm.
Aspirin is from
Hmm.
tree bark,
Hmm.
um, blood thinner, and so it's not it's not out of the ordinary. I think the thing that's difficult too is that because this is a new virus, we're in a
Hmm.
pandemic. Um, it's hard to be able to do the studies to really see like something is effective or it isn't effective. Um, but I think if we don't see that it's harmful,
Hmm.
I wouldn't be opposed to using some of these other um, remedies or treatments.
Well, we've had the vitamin D around here. We, did turmeric, garlic, um,
Hmm.
pretty much every night. There's a few other herbs that we as a practice have taken as our buffer against COVID-19, and I think thus far it's been good. I haven't felt sick, but you're saying we could be walking around here infected and not know it. Yikes.
Yeah. Um,
See, when we say that, all right, when we say that, that makes you even more, leery, and then you say, okay, I need to go take this vaccine. But on the other hand, and I'm just thinking out loud here. On the other hand, I don't trust the government to because of the past record and just what's going
mhm,
on all around me right now in this country. Um, how do I come to a peaceful center? I mean, I might be taking all the natural herbs and all of that, but based on what you're seeing in your view, and I trust you, I'm there, I'm with you.
mhm,
You're on the front line. You see what you see. Heck, I shouldn't even be going to the grocery store, let alone around the corner to move my car or whatever. I shouldn't even be going outside. I need to get one of those hazmat suits and just sit up in here. This is serious stuff.
mhm. It is. It is. I will say that it is. So we know a lot now about how the virus is transmitted. And so it's
Hmm.
really about being in close contact with somebody for prolonged periods of time. So that's why in general, the public health recommendations are to not be indoors at all with people who are not in your household,
Hmm.
um, that you don't live with, and to avoid gathering in general with people who are outside of your household, because that's really what the big risk is. So going to the grocery store, yes, there is a risk. But we know that you have to live life, and so that's when it's important to kind of do those other precautions, the
Hmm.
mask
Hmm.
wearing and the distancing, and going when it's not as busy, and those types of washing your hands, and those types of things. So it's really, where we see the risk is when you're around other people, especially without a mask, especially indoors. And especially the larger, the more people, of course, that you're around, then the more chances are that one of them or more could be infected and not know it.
All right, now let's just keep it real here. There are certain communities that are like F the mask, okay? And you can
Hmm.
see that they're having protests. If I drive down the road to Huntington Beach, they not
Hmm.
try to wear their mask. If I go over, I think to be honest with you, that's probably one of the reasons why our studio is in the East Village Arts District. I'm going to call it out, right? And so uh, as business owners have really, struggled with okay, should we keep our space or, well, I mean, just like the restaurant owners, we're not a restaurant, but it's some financial considerations as
Hmm.
business owners. Should we keep our space and all that whole thing? But when we drive over to that area, ain't nobody wearing a mask. It's
Hmm.
crazy, And so, what do you say to that? I mean, you're saying we have to wear a mask. You're saying we wash our hands, all of that. But clearly, a lot of people are like, this is some form of control. I'm going to walk around. I feel privileged, so I ain't going to wear my mask. Those are spreaders to me.
Well, I mean, yeah, I wouldn't recommend that people be around. So, I'm recommending that you wear a mask. So, if you're around people and they're not wearing a mask, then I do think it's, not a good idea to be around them. Um, I think and hope that as information is communicated, that we can act on the information.
Mm-hmm.
That's what's going to get our schools open, is
Mm-hmm.
wearing masks. That's what's going to get our restaurants opened, is wearing masks. That's what's going to get the rest of our businesses open. And it has been a huge toll on our businesses and our
Mm-hmm.
schools. Um, and so I hope that we're able to take the recommendations that are going to allow us to get our lives back and to get our economy back. And it's wearing a mask. I mean, there's just
Mm-hmm.
no other way around it. There is nothing else. We are not going to be able to, there's not going to be enough vaccine to be able to vaccinate our way out of wearing a mask. We're going to have to, for the foreseeable future, for the next several months, we're going to have to wear a mask. We're going to have to physically distance. Um, and again, I feel like, when you look at it and you look at the costs and benefits, I'm like, I'd rather wear a mask and know that we're safe, and able to get schools back open, than to not wear them and be in the
All right.
situation we're in.
I'm going to engage in some snitching right now. I'm going to ask you, as the health officer of Long Beach, just to take your team and walk through or drive through, however you do, the East Village Arts District. Maybe do it on a Friday or something like that. And
Hmm.
then let me know what you see. And then, enact some whatever you do to make those people wear masks,
Yeah,
because the folks aren't trying to do it.
I understand that, and we've really tried to be educational, and uh, I hope that we can see the benefits,
Mm-hmm.
and to kind of do the right thing.
Mm-hmm. All right. Okay, so one of my favorite things is to, go on our beautiful shoreline, and that's where I go and I run. I get my miles on and all that, but I can't breathe through my mask. So when I'm running, I'm trying to maintain social distance and everything, but I got to take my mask off because I got to breathe, especially
Hmm.
when I get up into those upper miles. Am I safe?
So safe is a hard word. I think it's always relative while we're in a
Mm-hmm.
pandemic.
Mm-hmm.
So I think that if you can get yourself away from other people, I understand you need to take off a mask in order to be to breathe while you're physically exercising, which is a very important activity for our mental and our physical health.
Mm-hmm.
And I think you have to modify it to lessen your risk. And so it's not being around people. I mean, it's
Mm-hmm.
being, if you can get like 12 feet away from other people while you're running, that's what I would recommend.
Mm-hmm. 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 This is very, very powerful stuff, and I would love for you to continue dialogue with us so we can help you get the word out on what we should do. I can't say that I'm completely 100% convinced today, but I will say that I'm duly noted.
And I think it's okay. I think it's normal, and it's okay. And I think just keep having those conversations. I think that that's the important part of all of this. And, when you're ready, it'll be there.
Mhm,
Yeah, keep asking your questions, keep challenging things. I think that
mhm,
that's really important.
mhm. All right, now I just want to switch lanes here real quick because I just died to ask you, right? All right, so the big story, I guess, right before the end of the year, you're up there at the city council, and the city council woman asked you, "What are your credentials?"
Hmm.
And the sisters in the community, they wrote a letter. They were ready to fight on your
Hmm.
behalf. Okay. Did you feel marginalized in that line of questioning? Because you know what, to be honest with you, I mean, they have a point. Sometimes, that's our badge that we have to wear historically, where you're constantly having to prove themselves. But just you personally, did you feel,
Hmm.
marginalized at the time?
In the moment, no. When you're doing a presentation in front of a lot of people, there's a lot of adrenaline and
Hmm.
nervousness. And so, no, I just felt like, oh, this was, a question that was easy to answer. I felt like it was a great opportunity to talk about my credentials and my
Hmm.
connection to Long Beach. Really, it wasn't
Hmm.
about the medical credentials because I really took that for granted. I'm like, I'm a health
Hmm.
officer. You have to be a doctor. I didn't understand, like, a lot of people don't really know what a health officer is and that it actually is a medical doctor. But no, I was just like happy to talk about growing up in Long Beach, and doing my medical residency in Long Beach and
Hmm.
graduating from high school in Long Beach. Um, it wasn't until later, but I will say, and it wasn't just the Black sisters, it was a bunch of people who were concerned about that question. And it
Sure.
wasn't until later that, you know, I don't there's always an underpinning when
Hmm.
questions like this, and it might not necessarily be the questioner who has that in their head. But I think what's been happening with the pandemic is that, those individuals that you were talking about who don't want to wear a
Hmm.
mask and don't want to close their businesses
Hmm.
are looking for whatever they can to discredit the message.
I
And
understand.
so if that's you being a woman, if it's you being Black, if it's, whatever, then they use that. And so I do think there was an underpinning of that in
Hmm.
in the questions that elected officials are getting, because
Hmm.
people are just using whatever they can.
Sure, but we're in this space now where racism and unconscious bias and all these fancy terms they have now
Yep.
are really coming to bear, and
Yes.
so I felt like that was a pretty interesting situation. I was like, yeah, because I've been in some situations where people are, and it might be coming. It's coming from that unconscious space, right?
Right.
Where it's like, okay, what are really your credentials to do what you do? And you get,
Right.
oh God, I got to explain to you, and
Yeah.
you get frustrated. Is racism a public health crisis?
Oh, definitely. It is the underpinning of all of the disparities that we're seeing in the African American, in African American healthcare, Latinx population, Asian population. The it all starts, I want to say systemic racism is kind of the tree that bears all of this rotten fruit that
Hmm.
we have to deal with, which is the unequal housing,
Hmm.
the poor educational opportunities, the fact that you can't get a job, criminal justice system,
Hmm.
police brutality,
Hmm.
all the ways that we're treated inequitably in this country is all coming from systemic racism,
Hmm.
healthcare. And so we're always dealing with that at the bottom. That's always, the fruit of all of that is, dying more of COVID-19, being
Hmm.
hospitalized more from COVID-19. We're the frontline workers. We have to take public transportation. We have
Hmm.
higher density housing where we live with multi generations. All of that is coming from systemic racism. And that is what we have to deal with in order to address disparities in COVID-19 and disparities in HIV, disparities in STDs, diabetes, high blood pressure. All of those things are a direct result of our experience in the United States with systemic racism.
Hmm. Now, let me ask you a question. That's really really great. So, what do you do as a public health official? So, if it's a public
Mhm.
health crisis, and then we see in the headlines, oh, the city is declared it a public health crisis. Okay, now what? What happens?
Right. So the city is, I think, all of us, public health is all of us in
Right.
some form, and so I think all of us need to be standing up against systemic racism and all of the, you know, uh, things that it causes.
Hmm.
The city does have a racial equity plan. We are looking at racial equity as a city. I think all of us who, you know, care about housing, education, jobs, criminal justice reform, really need to stand together.
Hmm.
And that's what I hope that comes out of this pandemic and George Floyd's murder. Like there was a lot of things, and the January 6th. There were a lot of things that kind of coalesced during this time that I hope helps us see that, you know, if you're for housing, if that's your thing, you know, then you're for systemic racism.
Mm-hmm.
You're an anti-racist. If you're
Mm-hmm.
trying to have equal, if you're trying to promote COVID vaccinations in the Black community, you're an anti-racist. And so if we could just kind of coalesce that together, that's millions and millions of people that are really all fighting for the same thing, which is for
Mm-hmm.
everyone in America to have what it takes to live healthy, happy, productive lives.
Mm-hmm. Yeah, it's that's truly the concept of America, right? Where everybody is equal, right? And that's the experiment.
Concept. Yes.
That's
Yes.
but wow, we got a long way to go. And I guess we've come a long way for sure.
Hmm.
We have a long way to go. And man, I'm just really pray for this. Now, let me just ask you. Okay, one last question here. Coming to the end of our time, but I really feel for the parents out there that are having to, homeschool their kids, technology, all of this whole thing, and on one hand, the state says, okay, you can open up the school systems, but the teachers are like, no, 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 no. What would you say? What will it take from your end of this whole, multi-layered project to convince parents that it is safe, parents and teachers, that it's safe to now go to school?
I think part of it will be seeing it be done. So there are some schools that are open now. Long Beach also did hit the mark for that allows more schools to open. So I think just seeing, just like some people don't want to be the first one, but seeing what other people do and how successful they are, I think that that will be important. I think also the being able to adhere to precautions. So it's not like we're saying, oh, schools can open, everybody go in. It's very different now. So it's mask wearing again. It's, not having all the same number of people in the classroom, using outdoor spaces if you can, maybe having a hybrid. So I think that those really are the two things that I would look for teachers and parents. I would look to see, the schools that are already open, how are they doing? And then how committed is the school and
Mm,
all of the stakeholders, the parents, the children, the teachers, the administrators, to really adhering to the precautions that we've seen that
mm,
make a difference. And then I think also paying attention to the data. There is a lot of growing data now that you can have safe reopenings of schools if you adhere to the precautions. But I think you know, um,
I'm gonna
I
need
can
you to get
understand.
that. I'm gonna need you to get that 50% number down first, though. what
Well, our
what
numbers
is
are going down. They are
yeah.
going down. And I think the thing that's important is if you want to go to school, then, what are you personally willing to commit to? A lot of the cases come from gatherings. So are you willing to not do those things so that we can get kids in schools? I mean, it's kind of, what are you willing to kind of sacrifice in order to have the low enough numbers that we can get kids in school? And I really do think we can do it. I really do. But I do understand people's hesitation. And I think, again, you have to do what works for your family. If you have a lot of older adults in your family, and they have a lot of underlying health conditions and you want to continue distance learning, by all means, that will be open to you and you should be able to do that. But for those that, feel like, hey, I'm adhering to all the precautions, I'll make sure my kid adheres to all the precautions and I want to do this, my kid is really suffering in some way, then that is going to be available to you as well.
I'm gonna send my kid to school in a hazmat suit. That's what I see. Coming looking like he'd landed on Mars. Something like he could go to school like that.
Yeah. And I think there's lots of different ways to do education. So, and socialization.
Mm-hmm.
Um, Yeah.
Yeah, because you know what, my grandsons they're twins, but they're seniors in high school, and I really feel bad for them because they
Hmm.
don't get to do prom, they don't get to do all the cool
I
stuff
know.
that comes with being a senior in high school.
I
It's
know.
like, and I was talking to him the other day. I said, well, do you make friends now? He says no, because everybody's got their camera off. So,
Hmm.
there's all of those experiences that last throughout your lifetime that now we have two classes now that don't
Yeah.
have that experience now, and that's really messed up.
Yeah.
No prom, can't go to the prom, can't go to the football game.
I
Come
know.
on.
I know. I know.
Who did this? All
Yeah.
right. Dr.
Good.
Anissa Davis, thank you so much for coming through and Coffee Conversations with Greg J. It's been
Thanks for
very
having me.
enlightening. Thank you. And we're going to have you back. We'll talk about some more stuff. If you have any messages that you need to get out to the people, certainly let us know. We really are dedicated to informing and inspiring our audience. And so we also have invitations, and it looks like it's going to happen for the California Surgeon General to come
Wonderful.
through, and that's Black woman, right? And
Hmm.
the head of the Martin Luther King Community Hospital,
Mm.
the head of the Charles Drew University of Medicine and Science. So we're going to have a string of all stars, including yourself, all these Hall of Famers to come through and talk to the people about this. How are we going to deal with this COVID-19? The vaccine. So, are we safe? I suppose. We trust you there, Doctor
Yeah.
Davis. So,
There's things you can do to
okay,
be safer, and
hmm
vaccination is one of them. So just keep
vaccination.
keep rolling it around in your head.
All
And
right,
thank you so
very
much
good.
for doing this. This is really important. It sounds like you're going to have some great people that to really provide information and to give a bunch of different perspectives. So that's wonderful. Thank you.
Yes, thank you. All right, y'all. Look, you want to be here on Thursday because we're going to talk to we've been it's Black History Month, right? And you remember last week we had the guy from the San Bernardino Board of Education, Brother Hardy Brown the second, great family and Black media, and showed us the slave chains and all of that. But
Mm.
right here in Long Beach, we're going to have the family of Sharon and David McLucas, with their exhibit Forgotten Images for one part of the show. On another part, all the way from the University of Vermont, a sociologist, Dr. James Lowen. Now, let me just tell you about this. All right. Some of you all don't know that back in the day, you had sundown towns. So,
Mhm.
some of your city, if you look back in the day, if you were caught out after sundown, it's not going to be good for you. And
Mhm.
so he has studied this whole thing and how history is taught in our schools. A sociologist, and he'll be coming from the University of Vermont to talk about sundown towns. And you would be surprised here in our area, Inglewood, there were sundown towns, Torrance, Hawthorne.
Mhm.
This
I
is
think
really,
Culver
really great
City.
stuff. Culver City, right?
I think
Exactly.
Glendale. I don't know if you mentioned that one.
Glendale, yes,
Mhm.
Glendale, quite a few. We try to find out if there was Long Beach, but we don't know. And
Mm.
he actually asked me that question. He says, "Are you sure?" So he said he was going to look into it, but I do know that I was at an event one time, and one of the former city councilmen was there, and we were downtown at the Museum of Art, and got our little champagne there, and we're at the event, and he says, "Yeah, I remember when we couldn't come down here." And it was
Mm.
such a profound statement, right? You're like,
Mhm.
dang, this is really, really, really something. And so that's the history. That's American history. That's Black history. We're going to study that on Thursday. All right, y'all. All right. Love one another.
Mhm.
Love one another.
Yep.
Love one another. Peace and blessings.